Hey y'all, it's your girl Dr. Malika on Pivot with Dr. Malika, and I'm so glad you're here with me today. Listen, I've got a great show. Today we're gonna do delve into the medical field a little bit, and I'm so delightful to have Jasmine Pinder here with us, who is a respiratory therapist. She's been in the field for over 10 years. She's a respiratory therapist at Forbes Hospital as well as Indiana Regional Medical Center, and she's here to represent the field. I think it was the second week in October was Respiratory Care Week, and we don't talk about it. We don't talk to a lot of respiratory therapists. We don't talk to folks who are in the field who can share about it. And also the idea that when you enter the hospital, okay, when you go to emergency, a lot of times there is a team of people that work with you to help you to live, to experience success, okay, with your life. And so that is a doctor, that's a nurse, but that's also um, a respiratory therapist. And so I am so excited to be able to bring Jasmine here to talk a little bit about herself, about being in the field of respiratory care. And you're going to hear me exchange the two terms respiratory therapy, respiratory care. But we're just going to get right into it. So, y'all, Pivot family, I want you to welcome Jasmine Pinder.
Hello.
Hi, Jasmine.
Hi.
Jasmine and I have known each other for a long time. Let's just say that. And so I knew her when she was a student, but now she is a professional. Okay, she is
Yes,
saving
ma'am.
lives.
Yeah.
So,
Yes.
Jasmine, I did a little intro. Talk a little bit about who you are. Who is Jasmine Pinder?
Okay. Well, I am obviously a respiratory therapist, but aside from those things, I am a mother of two girls, and I am a wife, and I do. I would call myself heavily involved in church ministry. Um, Aside from that, I'm a sister, a daughter, all these things. So, yeah, just very involved, I would say, in church and work and at home. So yeah.
Yes, very nice. I have the pleasure of working with Jasmine from Sunday to Sunday, and she is sweet, and she's sweet. Um, Pivot family, but she is no joke, okay, when it comes to doing the Lord's work on the stage in front of God's
And
people.
that's
All
so.
right.
Hmm.
So,
And it is known.
yes, that's right. But today we really want to delve into and unpack respiratory therapy. Um, I remember attending your graduation, Jasmine, back in blah blah blah.
Yes.
And I just remember sitting back. I remember being in an auditorium, I think it was, and sitting back and watching you receive your the accolades and your degree and all of those things, and them calling your name and thinking to myself, now, what does a respiratory therapist do? And how
Yeah.
often, like, I knew that it was hard work to get to
Mhm.
where you are. I knew, I remember the stories. But I want you to talk a little bit about what is respiratory therapy and what role do you play um, for a patient who may come to the hospital. Well, let's start there. Like, what is respiratory therapy?
Okay, so respiratory therapy is kind of like a specialty field of the care team. You can do in the hospital setting, outside of the hospital setting, home care setting. Um, And basically, we assist with the assessment, diagnosis, and treatment of patients that are experiencing any cardiopulmonary issues, which
Mm,
anything related to heart and lungs. So think like
okay.
congestive heart failure, pulmonary hypertension, the more commonly known like asthma, pneumonia, even like neurological patients. We're
Yes.
seeing people that may have myasthenia gravis or even autoimmune where you have cancer, ALS. We deal with the babies, premature babies, babies that are overdue. So there's like a very wide span of our patient population. So when I say heart and lung issues, it really goes from top to bottom. Any number of patients could see us during their stay in a hospital or could see us outside of the hospital setting. Um, you think of like sleep apnea, we're dealing with those patients, pulmonary
Okay.
rehab, all those things. Um, so I could be here all day with like the patient population, but most oftentimes we are dealing with a lot of the patients that you know, everyone sees or somebody knows somebody who has seen or had a respiratory therapist.
Okay. That now that's a lot. Okay, that
Yeah.
is so the respiratory therapist has a lot of responsibility. And I want you to just take us through what a shift may look like. So you come on at whatever time, and what exactly does that look like? An 8-hour shift or a 10-hour shift look like for you? What is the normal shift for you? That's probably the
Uh,
better question.
so I have been a night shift probably 10 years. Aside from
Wow.
when I first started, I have always been, and even then, I've always been on night shift. I'm not really a daylight girly, so um,
She's like,
I don't get
"Ah."
up early. No, so typically, like on the day shift versus night shift, it's a little bit different.
Okay.
There's a lot less people in the hospital during the night, which is kind of why I like it. You can kind of get in, do your job, and there's not a lot of interference, if you will.
Okay. Okay.
Um, but on a day to day, like for a normal shift, most of us the, do the same things. We're checking people's oxygen levels, doing assessments. We are passing medications that are due. We are giving medications that aren't necessarily due, but they're just needed at that time.
Okay.
We managing airways. So, people who I don't know if anybody's ever run into someone who's had like a tracheostomy or a hole here to help
Mm.
them breathe. We're managing those, cleaning those. Um, we are depending on what time you come in, you could be doing some we call them walks. You would walk a patient to
Okay.
see if they need oxygen before they go home, setting them up with that.
Wow.
And then you have like your what we call like break time,
Okay.
um, where you could like if I like to chart during that time, that way I can get everything done. And
Mhm.
then you go out and do it again every 4 hours, sometimes every 2 hours, sometimes every
Okay.
6 hours. There's just things that are due at various points through the night. And then come 5:30, you kind of sit down and you write your report out for the shift. The only thing is that like there's a lot of things scheduled, but there's a lot of things that are not scheduled that kind of interrupt
Mm.
your workflow. And
Okay.
so every night looks different. You can go
Okay.
in, pass your meds and have nothing happen, or you can go in and not even be able to get to your floor because so much is happening. So it's variable in that way. Like you just never know what you're going to get when you walk in and clock in.
Okay. So are you assigned floors? Like you were assigned a floor once you
Yes. Oh,
Okay.
multiple floors. So like night shift, we get a so I work at two different hospitals,
Okay.
different in size and different in nature. One is a
Okay.
trauma center, one is a kind of like rural community hospital. And so
Okay.
very different your day looks different at each one of
Right.
those. You get assigned on average, I would say maybe 2 to 3 floors
Mhm. Mhm.
of patients. And then if you have a critical area, maybe you'll have a little bit less of an assignment because your patients require a little bit more
Okay.
attention and care. But usually 2 to 3 floors, that could range between any number, like 20 to 40 patients
Okay.
uh, that you're managing.
What is it about respiratory therapy that you were attracted to it and said, I want to do this? Because there might be someone out there who's thinking, I want to go into the medical field, but I'm not sure. right? I don't
Mhm,
know.
mhm.
So what was it for you? What was it for you?
So I came to IUP and I was determined to be a dermatologist.
Okay.
So
Okay.
I started out as bio pre-med, and actually, which, that's a whole nother conversation. I had someone discourage me by saying, I had like a 3.9, 4.0 my first couple semesters. I was getting a C in, I think, Chem 2.
Okay.
And it was like a high C, but at that time it's like I had a 4.0. Like, I don't want to ruin this. Y'all all know
Right.
your GPA dips and it takes 58
Right.
steps
It
to get
takes
it
for
back.
yes.
Yeah. And
Right.
so, med school is competitive. So my advisor at the time was like, you might want to reconsider if these are the grades that you're going to be getting. And I just let that get to me. And so I took
Mm.
myself out of the major and I tried to get into the nursing program, but it was a 2-year wait at the time, and I didn't have money to wait. So I
Right.
asked one woman in the nursing and allied health, like, what can I do? I don't have a lot of time. I've already, been through a year and a half of classes. I don't want to waste that. And she recommended actually respiratory therapy to me. And so I took like an
Wow.
intro class, and it was like one credit, and we just kind of like went through what is respiratory therapy, what are some things. We took a tour of the facility because it was it was in a bridge program. So
Okay.
we did our classes in Pittsburgh, but at that point I'm like, I can do this. This is still patient care. Like, I still get to see patients, I still get to assess. I'm like, pretty involved in their entry and leaving, the full span of care. So some fields where like you see them and then you never know what happens. But like
Right.
as a respiratory therapist, you can kind of like follow them through their healthcare plan. And so I was like, you sold me. I'll do it. And then from then on, I just
Wow.
kind of like did, you know.
So you actually, you kind of pivoted. You
I
did
did.
pivot. You
I
really
did.
weren't this wasn't the original plan.
It was not.
Um
You know,
because of one C that okay, Jasmine, I've worked in higher ed. And so
yeah.
I'm like, that's a whole
Yeah,
nother kind of
yeah.
like, what?
I know. So I said that's a whole other conversation.
What? That's a whole nother
Mhm.
conversation. It
Yeah.
indeed. But,
Mhm.
it looks like you have excelled in what you do. And so there is something in you that enjoys patient care
Yes.
and, working with patients. And so I think, we appreciate what you do for sure. Um, I think what people don't know too is there is a team. And I mentioned that earlier. There is a team that works with patients. So talk a little bit about that team interaction and that dependence on one another as a team. I think sometimes we look at the doctor and we say the doctor,
Mhm.
it's, has of course, they may have the highest level of decision making on some things, but is there a time where maybe in the team, the respiratory therapist needs to make a decision and advise
Mhm.
the other team members? So, can you talk a little bit about that?
Equality beat.
Yes, it's actually kind of weird. I have there's everywhere you work is a little different with the level of trust, or we call it autonomy, that you have as a respiratory therapist involved in the care. And so some places have protocols that allow you to kind of make your own decisions and
Hmm.
manage the patient care at that level, in regards to like medication administration, or patients on the ventilator or life support. you can look at blood work and kind of make certain decisions just with
Okay.
your expertise. And then on the other end, I've worked at facilities where there is not very much autonomy and you're like locked in with whatever's ordered by the physician.
Okay.
But we still, in both instances, are a part of the healthcare team and can definitely give input.
Right.
Um, a lot of times there are what's in critical areas we do rounding, and so the
Okay.
whole team comes together. That could look like physical therapy, occupational therapy, nursing, physician, dietary, the pharmacist, and we all go patient to patient and discuss their care, what their plan is, how we're going to get them healthy and out the door. And so we play a very, I would say, important role in that because breathing, I would say, I mean, no bias here, but it's probably really high up there on the level of importance.
I would agree. I want to live.
I'm,
If I
yeah,
want to live, I got to breathe.
yeah, and that's, so we are definitely experts. I don't think, this is just my personal opinion, I don't think that we get the credit or the um, I wouldn't know what word to use
Maybe
other than
recognition.
credit, recognition that we deserve. I think a lot of people have a misunderstanding of the level of knowledge that we do have. And
Mm.
so we get kind of like shut out of the decision making process because there's not a lot of trust there. And so while I would love to have input, I'm speaking for myself. I
Okay.
will suggest. I don't know if it's the proper protocol or not, but I'm always one to be like, "Hey, explain to me why we're doing this," or "Have you
Mm-hmm.
tried or have you thought of X, Y, or Z?" And that's just me by nature. Like if I know something, I would like to share it. Or if I
Right.
think that and I'm always open, like, if there's a reason why we're not doing it this way, because I'm, again, a specialty field. So I'm looking very
Mm-hmm.
specifically at one thing as it relates to the body. There might be other parts, which is why we're a team again. Oh, we can't do that because their kidneys are
Right. 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 Right.
because pharmacy will chime in that medication does not is not you can't give that with what they're getting. And
Okay.
so we don't always get recognized. A lot of people don't ask our opinion. There's a lot of people have a misunderstanding of the level of knowledge that we have. So sometimes it can seem like we're just giving meds and doing the run of the mill things, and they think that's all we know or that's all we do. So I like to tell them, like, hey, I know other things. I I have
Right.
something to give. I have something to provide to the team. And whether it's received or not, that's neither here nor there. Again, if you want to be a respiratory therapist, you're not going to do it for the recognition. Just put that out there right now.
Right.
So
Right.
yeah.
That's interesting. Two things that come to mind. One, I'm going to read, but the other is that, in respiratory care, you have a voice and you have a platform, or, like we like to talk about, a seat at the table. So every night you have a seat at the table, or every shift, right? Could be other
Mhm.
respiratory care folks out there, you have a shift. So you have an automatic seat at the table, but yet there might be times when your voice isn't heard the way you'd like it to be, right?
Yeah.
But I think what I like about what you're saying is, you do sometimes you'll say, "Hey, I have something to share. I might have something, or can I ask a question about why we might be doing this?" Not out of disrespect, but just out of possibly having something to contribute to that solution. And I
Mhm.
think that that's so important. I think that's an important lesson to learn, Pivot Family, because we talk about having a voice. There are articles, tons of articles out there of motivational speakers who talk about having your voice, right? Getting a seat at
Yeah.
the table,
Mhm.
and especially in the business world, having a seat at the table. And a seat at the table is not always a seat in the meetings, but sometimes it's
Right.
with a patient, right?
Mhm.
In the room with the patient,
Right.
trying to diagnose what we need to do next, right?
Right. Yep,
And
absolutely.
I don't know if diagnose is the right word, or decide, what is the next
Yeah,
thing, yeah, that we need to do. So I appreciate you, Jasmine, having a seat at the table, but also recognizing your voice and at times chiming in and saying,
yeah,
"Hey, I'm here for more
yeah.
than just
Hey,
this one thing."
respiratory.
Yeah,
Mhm,
yeah.
mhm.
But the second thing that came to mind was Respiratory Care Week. Um, I did not even know it existed.
And a
Um,
lot of people don't.
I
Yeah.
know. Respiratory Care Week, I'm just going to read this. It's an annual observance that recognizes the vital contributions of respiratory therapists and highlights the importance of respiratory health. It's typically held during the last full week of October and serves as both an educational and appreciation campaign. And basically, it was established to raise some awareness about the essential role that respiratory therapists play in diagnosing, treating, and managing patients with difficult breathing and more. And so, you work at two different facilities. So,
Mhm.
is there a difference in maybe how respiratory care is celebrated or acknowledged or appreciated?
No, it's pretty much the same. We just get a lot of food. Um,
But it is
we send
recognized.
sandwiches. Yeah, I mean, I just don't, it's not like a big to do.
Right,
I've never
right,
worked
right.
at a space where they've made it like a big deal.
Okay.
Some years are, you get things, and then other years you just don't.
Right.
You kind of just grow accustomed to, like, this is what it is. Your hospital
Yeah.
may put it up in an email, you might not get, and people might not know. Other
Right,
hospital
right,
people might not know. It just depends on the facility, but in large we just get like food, pizza, sandwiches,
right, right.
stuff like that, sometimes pens.
Oh, that's
Yeah,
nice. Okay, okay.
yeah.
Well, listen, we recognize we're a little late, but we recognize respiratory therapists, okay? And we
Thanks.
appreciate the work that you do. Um, Switching gears a little bit though, I
Okay.
wonder, what is, and this is, you're gonna have to think. So don't
Okay.
be, there might be a little bit of an awkward pause. Think about one of your most memorable experiences as a respiratory therapist. I know, right? You're like, what? What?
Wow.
What is um an event or a situation that really sticks out to you? Right? You're always gonna
I
remember.
I actually, like, know this
Oh,
off
good.
rip because it's just, to me, it was a miracle, and I'm like, I will never forget this ever.
Okay.
Patient, and of course, it's, like, during COVID, and every
Mm,
day it's like, how many people are going to die today? You would go in and, like, prepare yourself,
mm,
and so it was a very dark time. Like,
yeah.
you go into the hospital and you don't really expect much, but there was actually a patient who had gotten COVID and,
Mm-hmm.
like, progressed very rapidly on, like, in the decline. So, you just kind of like mentally prepare because you grow attached to the patients. They're in the ICU for 20 plus days at this point. And we're just trying
Right.
everything we can do to keep them alive. And so,
Mm-hmm.
one particular patient, he was like on the decline for days and days. And you get to a point where you're like, we need to make a decision as to how
Mm,
we're going to proceed. If we're just going to progress with making them comfortable, or are we still fighting? And so,
okay.
um, I don't know. Call it a miracle from the Lord.
That's
The
right.
patient
That's all
started
right. We talk about the
to,
Lord here. It's okay.
yes, like I said, oh my gosh. I don't know what the turnaround was, or what it actually like caused the turnaround or the shift. But when I say we got to see him come full circle to like death's door, to
Wow.
discharged from the hospital, walking and talking, I could not believe my eyes because it's like you send I pray like, Lord, like we need hope. Everybody is
Right.
dying. I mean,
Right.
young people, old people, they're walking and talking, and the next minute, like you're calling their family, and I'm like, I cannot do this, okay?
Right.
For
Right.
years
Right.
and years at a time, please send
Yeah.
hope. And
Yeah.
this was my hope patient. Like I was like, like people can live. And
Yeah.
so
Yeah.
that him for me, I remember his name. I remember exactly what he looks like. Like I don't know where he's from, but I'm like, Lord, like I see you. And
Mm.
I remember his wife just being like so grateful. And quite honestly, it was like, well, what did you do? I don't know, girl, everything. All the things we knew how to do.
Right.
And it's just
Right.
like, yeah. And like everybody was like, we were all fighting. We fight for every patient that walks in. But, it
Mhm.
was like, once we saw that turnaround, it was like, oh my gosh, like there is hope. Please.
Yes.
Yeah, and I remember
Yes.
him very vividly just living through that. I'm like, "You have a testimony, sir, and I want you to share it with the world because that is
That's
crazy to
good.
me." Mhm. I mean,
Wow.
everything. He had, like, feeding tubes and all types of cuts, and he had ended up having to get a trach because he was intubated for so long. When I tell you, I mean, he was talking and walking out the door. I can't believe it.
It wasn't time.
Hey, I said, "Golly, Lord, you did it again."
He did it again. I love those stories and I
Mhm.
love those miracles. I love when you can see
Yeah.
God at work. That's awesome.
Yes.
And I think especially during COVID, I remember some of the stories, and I don't know. I mean, your household probably knows all the stories, but I know some of the
Yes.
stories and the experiences that you had, and
Mhm.
just having to come home. And I think like you had to go downstairs and or
Yes,
go
it was the
and
whole process.
it was
Yes.
a process before you could even, come together with
Mhm.
your children and your husband.
Yes.
It was
It was a
like,
lot. Yes, it was a lot.
and there was a lot of death around you,
Mhm.
at
Mhm.
from one shift to another. So I think that that's beautiful when you can see that light of hope, when you can see the miracle,
Yeah.
and it probably propels you to continue, right?
Yes, it does.
Yeah, yeah,
Mhm.
in the
It
field.
certainly does.
So, when you think about where is we think about healthcare, or we're talking about respiratory care, in a 10-year span, how do you think healthcare has changed? How has that impacted your work? Do you see differences from the time you started in hospitals until to now? Um, would you say there have been major changes that have impacted your work in a 10-year span?
Obviously, I think, like, COVID really did change how we do things moving forward.
Mhm.
The way we treat patients, the things that we, like, look out for, and also we've kind of put together a lot of stuff. So it's like, "Oh,
Okay.
we're capable of doing X, Y, or Z," or, "Oh, have you tried this?" Because we did it during COVID, and so I think it helps
Right.
to treat a different number of patients because
Mhm.
a lot of the things that you saw with COVID were, I mean, symptoms ranging from GI to respiratory, like, and the like. So
Right.
different treatment methods I would see since COVID, and I think that also, just like for the main thing is probably like equipment
Mm.
improvement. There's like things always coming out. We're always having in services on this new and improved way of doing.
Right.
When I started, there's machines called IPPBs, which it's like this green old ancient machine that we use to inflate people's lungs.
Okay.
That is no more. They do not even exist. I don't know if there's any hospital in America that still has them.
Right.
Um,
Okay.
and so, yeah, they have been since retired since I started. All of the things that I would like learn on in school, I would
Mhm.
say are kind of being phased out, even down to like the flutter valves. I know I'm saying these terms and people are probably like, I don't
And
even know
that's
what
okay, teach us.
yeah, even the flutter valve, it's like new and improved flutter valve with PEP therapy. It's like all these things. So that
Right.
every day, well, not every day, but every now and again, you're getting a new piece of equipment. You're, having to learn how to operate, use, and what patient population would this be good for.
Mhm.
But that would be the most, I mean, I think they're finding more efficient ways to deal with things. So instead of having, you know, a breathing treatment with your flutter, with your PEP, now they have like, oh, an all in one machine. You can do it all in one. Um,
Right.
and just kind of like streamlining because we have a lot of patients to see. So I like that in the sense of like, I could do it all in one. I don't have to spend 42 minutes because I also have 40 patients to see. So
Right.
I enjoy that. I hope we keep evolving in that way.
That's
See
good,
where
and it keeps you fresh, keeps your
Oh
respiratory
yeah.
therapist fresh, right?
Mhm.
Sharp,
Yeah.
right?
Yes.
Cutting edge technology.
Yes, all the things.
That's good. Jasmine, someone might want to go in the field. What would you tell them how to prepare? What are some things that what is at least one thing you wish you'd known then that you know now about yourself in the profession?
So it's okay to muddle through the classes and like you don't need to make perfect grades. I think the biggest thing was understanding patient care, bedside manner, and like all of the things will come. All of the experience to being able to think on your feet and troubleshoot, all of that will come. But don't
Mm,
get so like heavily involved with being book smart that you miss out on the because I struggled in the beginning with the
mm,
bedside manner. And I know our program was very, very much so very book heavy, knowledge based, which is very important. Like we want to keep people alive.
right,
So
right.
you do, and you do want to pass your national exam. So that is important, but like don't get so caught up in that that you miss like getting that experience and
Mhm.
asking the questions that you need to on like clinical and stuff like that. So
What's one word of encouragement that you would share with someone who might be a student or who might be thinking about let's start with who might be a student in the program.
okay.
So I'll start with that. What's one word of
Okay.
encouragement that you would share with them?
Um I would say just keep going. Don't get hung up on the last test or the last thing because, like I said, it's like finals week every week. You have a test in every class every week, all the time. There's constant evals. And so don't get hung up on the last test, even if it
Mm,
was a good grade. Keep moving forward, keep chugging along, keep gathering
yeah,
all that information, um, and just till you get to the end. Honestly, just keep
right,
going.
right.
Just
And what would you say to someone who is a fellow colleague? Could be across the country. Somebody might see this in respiratory care and just feels discouraged. And, it might even be contemplating, like, I don't even know if I want to continue in respiratory care. What do you tell them, Jasmine? What do you tell them?
I would say, remember why you did this in the first place. I think a lot of us had expectations when we came into the field. And I think as a field at Gross, I'm just going to say we're not largely recognized or appreciated um, for the level of knowledge and the extensive part of the team that we are. And it is discouraging, I will say, if you are not fully committed.
Mhm.
It's hard to go in, day out, be a part of saving a life and never get recognized, never know,
Mm.
nobody will ever know that you were there. Even the team sometimes they're like, "Where's respiratory?" And you're like, "Right here,
Wow.
been here the
Right.
whole time." I would say to that person, continue to just remember why you did it in the first place and be your own advocate.
Mm.
Let the people know that you are knowledgeable, whether they receive it or not, you know. But if you can learn to advocate for yourself, push
Mhm.
forward the knowledge that you have, you continue to grow and develop so that you are an asset. Um, Whether they validate your knowledge or not, you can share, you can advocate for your profession, you can give your 2 cents, if you will. Um, and I think that that really helps because it reminds you, like, I'm not just a puffer pusher. Uh,
Yeah. Yeah.
yeah, I'm not. I know. Like, what's the alveolar air equation? I don't know that any other profession has to learn it, but I know we have to know it to pass our boards. So,
Right.
you know how
Because I was
you
like,
know. Yeah. You know what you know. Be your
mhm.
advocate and be an advocate for your patients and remember why you got started in the first place. And I think that would be just my encouraging words to keep going.
Listen, we want to get this word out to as many people as
Yes.
possible uh, on Pivot with Dr. Malika that respiratory therapists are critical to the care of patients. They are important. They are appreciated. We appreciate
Yes.
you.
Thank
Um,
you.
and I think it's high time that we put
Mhm.
this message out there and put this out there to those who may not even understand what you do.
Right.
Um, so yes, we want to give a voice to the voiceless. We want to give a face to the what seems like invisible, but we know that you're very present and very
Yeah.
active. So, on behalf of the Pivot family, thank you,
Yes. Thank
Jasmine.
you.
We're going to put you
Mhm.
in the place of representing the respiratory care
Yes.
profession, right?
Thank
Thank you so
you.
much for all that you do. Don't go anywhere, but I'm going to come back with you, but I just want to thank you. Thank you for being here on Pivot with Dr. Malika. I think
Yeah.
that just such valuable information, and I hope this is not the last interview that you will have about what you do. I just declare it and speak it.
Jesus.
But thank you so much, Jasmine. Okay, don't
Yes.
go
Thank
anywhere.
you.
Don't go anywhere.
Okay.
Okay, y'all, listen. That was fantastic. Now you know respiratory care is critical, right? It is imperative that we understand who's taking care of us in the hospitals. And we have doctors and we have nurses, but we also have our respiratory therapists, and we want to thank them for the work that they have done and are doing for us. So the next time you're in the hospital, okay, don't go in the ER thanking the doctors and the nurses and forget about the respiratory therapist who might have been in there to help you while you were unconscious. Okay. Ask for the entire team. Thank the entire team. All right, y'all. So thank you so much for joining us on the show. And we'll be back. We'll be back talking to someone who has intentional or unexpected changes in their life. But guess what? They're still winning.